Hello, everyone. Welcome to Save News TV. I'm AZ Hubbard, your host. Thank you so much for allowing us into your homes. Tonight is a very, very, very special night. We're talking about some things that are not just our community, but we're going to focus on our community. And our guest tonight is Ruby Brown Herring. Welcome, Miss Herring. How are you doing tonight?
I'm doing great, AZ. Thank you for having me.
Oh, great. Could you share with our viewing audience, our listening audience, um, exactly who you are
Mhm.
and tell them a little bit about your history, please?
Sure. So I'm Ruby Brown Herring. I live in Raleigh, North Carolina, but I was born and raised in Eastern North Carolina, Sampson County. But I work with companies, nonprofits, government agencies to create strategies that support mental health in the workplace. That's my primary job. But I'm most passionate about reducing stigma and increasing mental health awareness, particularly within the Black communities, because I have lived experience myself as within my family. And that's kind of been my motivation for doing the work that I do.
Oh, wonderful. Well, one thing that we know that's been happening here recently is there has been, there's been an increase in suicide in the Black community.
Mhm.
However, we're seeing it more to headlining stars and everything that is making the news. And I wanted to clear a couple of things up. The reason why I refer to, a lot of people say African American and I say Black in this particular situation is because, number one, everyone isn't African American,
Right.
and there are plenty of Black people of our hue
Mhm.
that are affected by this. And so I want to be inclusive of
Mhm.
everyone that is of our hue because they're counted in that number that we're getting ready to discuss tonight.
Right. Yeah. And I think
So
that's important that you frame it that way, for sure.
yes. Well, one thing I wanted to also ask you to begin the dialogue is we have, like I said, there's a lot of headliners of people that have recently committed suicide,
Mhm.
and and the number is growing, and the
Mhm.
statistics are,
Mhm.
terrifying.
Mhm.
And at this point, we have a lot. As a matter of fact, the increase of the African American community is high at a higher rate than
Mhm.
at the other communities. As a matter of fact, there's a decrease, is it not, with other communities versus the African American communities?
I think we're seeing the numbers shift based upon a couple of factors within that. So, for instance, when we look at suicide data across the board, we put everybody in the pot together. The highest rate overall is in older white males. But where we're seeing the uptick is within the Black community, particularly with Black males, and in the Latino community within Latino females. And so it depends on
Mm.
how you kind of dig into the data, but overall it's white males, but within the Black community, it's absolutely black, black, black males, young black males at
Okay,
that.
right. And the number as far as the percentage is increase is growing more rapidly than within any other communities. Is that correct or
Yeah,
incorrect?
it is. We are seeing that in some of the data that's being released nationally. And I think part of that reason has been when we look at um, all of the things that particularly Black folks have dealt with when we look at social injustices over the
Yes.
last several
Now, are
years.
you finding that the one thing that's important is gentleness with discussing mental illness and suicide, because you and I had a conversation, and like I
Mhm.
stated, I thank God that I've never had those thoughts or
Mhm.
been in that type of
Mhm.
situation. And sometimes because people have not had those thoughts or been in that situation personally,
Mhm.
that
Mhm.
sometimes we overlook
Yeah.
signs.
Right.
Could you elaborate on that, please,
Right.
on how to see the signs
In the
and
sense.
how to?
Yeah. So one of the things that I think is important to as we start this conversation, is to really, particularly in the Black community, there's a huge myth around mental illness and whether or not it impacts us. But there's even a bigger myth around suicide in the Black community and all the stigmas around. I know growing up in East North Carolina, you're going to hell if you kill yourself, and so the data doesn't lie. And so knowing that when we look at that data, our folk, especially our young Black males, are impacted greatly. So I think some of the things to think about, and the really when we're looking at stigma, I mean, looking at some of those signs, warning signs of suicide, it's key to understand it's going to look different from person to person.
Okay.
And individuals that are considering suicide are good at hiding it. And so I'll give you a personal example, in a second. But some of those signs and symptoms that we may see is that individuals are talking about it. They're talking about death. They're talking about dying. They may say things like, "Nobody would miss me if I'm gone," right? Or the world would be a better place without me. And so just being in tune with what folks are saying. Other signs and symptoms that we may notice are people giving away their personal belongings. So there's a young
Mm.
young woman in Charlotte that does a lot of work around suicide prevention based upon her own experience with suicide prevention, with suicide attempts, and her aunt recognized that she was truly struggling when she started to give away her shoes. Her prized possession were her heels, and she started giving her heels away. And her aunt was like, "Wait a minute, something's not right."
Mm.
And so, paying attention to things like that can make the difference between someone living or dying. And so, I mentioned that because it's a story that I think a lot of us can identify with. If you have an individual in your life that says, if anything ever happens to me, this is where all my stuff is. So like my mom was big on that. She's like, if anything ever happens to me, you've got this drawer with this envelope with this stuff. So I didn't take that as her being suicidal. It was her saying, here's where my stuff is, so y'all know how to take care of stuff once I leave this world. But if you have a person that's constantly talking about paperwork, or let me make sure I've got my insurance lined up, let me make sure I've got this lined up, and kind of getting their affairs in order, that's something to pay attention to. And I think sometimes what happens is that depending upon our relationship with the person that may be suicidal, we may or may not see those signs, right? And so, an example is I have twin girls that are 19, and one of my daughters was diagnosed with anxiety and depression at the age of 10, right after my mother passed, and her and my mother were really tight. And so, I started noticing behavior issues in her. And my husband and I were like, okay, this is weird. And so I grew up with, okay, they're either going to grow out of it or you're going to beat them out of it, right? And so I noticed all these signs and symptoms
Mm.
acting out at home and whatnot. And I just thought it was her being a difficult preteen. Um, and she actually was suicidal and I missed it. Thankfully, she didn't attempt, but she had a plan. And so the reason that I share that is because as Black folk, we often see the behaviors, negative behaviors that our children exhibit, acting up, talking back, throwing stuff. She was doing all of that at home, but at school, she was fine. And then sometimes you may see it in school with your child, but at home, they're
Mm.
fine. And so just paying attention to those patterns and behavior changes and asking questions, because oftentimes what we found is that individuals, especially individuals that survived a suicide attempt, they've said, if somebody had just asked me, I would have told them, but I couldn't find the words to say to them, I'm thinking about killing myself. And so what that says to me, AZ, is that,
Mm.
they are in a deep dark place, and there are people who truly believe that the world would be better, their families would be better without them here. And so if we think about in a person that has a cancer diagnosis and they're going through chemo and things are really bad, and we're supporting them, we're taking care of them, checking on them, coming by, doing yard work, groceries, bringing food. But are we doing the same thing for folks that may be experiencing a mental health challenge or experiencing a suicide attempt? And so just paying attention to those patterns. When you notice something is different, it may not necessarily mean that that's what's going on, but you notice and just speak up to that person because it says to them, I see you. Because oftentimes they don't think, even though they have a world of folks rallying around them, they don't think people are paying attention.
Apostle Carmina Cox that is joining us tonight. For those that normally tune in on Wednesday nights, you all know who she is. And we are just so excited to have her join us tonight also because Apostle Carmina is the one who got me in contact with you. How are you doing today, Apostle Carmina? Okay, we're gonna let her get back in. Okay, but go ahead.
Yeah, so I think that when we think about it, is paying attention to when things change, when things change within a person, because when we look at, again, going back to the data, and for folks that say, oh, suicide doesn't won't impact my family, what we know is that suicide is the second leading cause of death in young people 15 to 25, 10 to 25.
Mm-hmm,
So second leading cause, only behind automobile accidents. So it's
mm-hmm,
happening. When we look at 35 to 44-year-olds, it's the fourth leading cause. And it's the fifth leading cause of folks 45 to 54. So it's in the top 5 for ages
oh,
10 to 54. And so knowing that, it's important that we have conversations like this so that we know what to look for, but also how to talk to folks, right? And one of the things I hear people say sometimes is, oh, I don't want to ask them about suicide because that's going to put it in their head. And that is absolutely not the case. People that are thinking about killing themselves, they're already thinking about it, whether you mention it or not. And so by asking them intentionally, saying, are you thinking about killing yourself? Are you thinking about um, taking your life? Right? Are you thinking about dying by suicide? Those questions are important to be that blunt, because if you say, are you thinking about harming yourself? That can mean anything. Right? And
okay.
so being intentional in that language. And then the last thing I'll say about the language piece is, notice I said died by suicide. And so one of the things that we see a lot in this in the suicide survivors community and research community is changing the language, because trying to reduce that stigma. We commit crimes, we commit adultery, we commit sins, right? And so saying died by suicide removes some of that stigma, and removes some of that wrong feeling about an individual that has died. Because if you die, folks that have died by cancer, we say they died by cancer, not that they committed cancer, right? And so
Mm-hmm.
looking at changing that language as we're talking about that as well.
Oh, okay. So one thing I wanted to ask you while we're in that line of questioning
Mhm.
is now one thing some people die by suicide, but they um you know either the either the police put themselves in a compromising position
Mhm.
to be harmed.
Mhm.
That happens
Mhm.
I mean everywhere. Have you found that to be the case?
Yeah,
Whether it's the police or whether it is using trains,
right.
things of that nature.
Yeah, and so that really kind of falls under death by lethal means, right? And so when we look at suicides and how people die, um, it can range anywhere from suicide by cop, which is kind of what you're talking about, It could also, so
Mm-hmm.
jumping in front of a train is, that's just a lethal mean. It's the same thing as someone that takes an intentional overdose, or someone that shoots themselves to kill themselves. And so that's just really how the method that they choose to end their life by.
Okay, so but is it still technically suicide?
Mhm. It is. Depending upon the
Okay.
person's reasoning. So, what we have, what research has shown around, especially individuals that die due to suicide by cop, when they've gone back and looked at their mental health history, there has been some history around suicidal behaviors, and leading up
Mm-hmm.
to their death. Usually, there's some type of mental health crisis that has happened, and so there are many cases where that is still deemed suicide. There are also cases where they're not really sure because that history isn't present.
Okay. Now, at that point, are you seeing are do they begin to exhibit the same behaviors if they're in that type of situation prior to them putting themselves in that situation for that to happen?
Right. So primarily what happens when an individual
As
is
far as
kind of,
what I'm saying is selling their clothes,
yeah,
doing things of that nature.
right. Yeah, typically there are some signs that has been exhibited over time. The tricky part is who saw those signs. So for instance, with me and my daughter, because I was looking at it from a mama lens, I missed it. I just thought she was being a disruptive child. In other
Mm-hmm.
situations, like some of those that you're talking about, it depends if it's from if it's their medical doctor that has noticed some of these behaviors. They're looking at it from a totally different lens, and they may see some of those signs and symptoms. So it really just depends on who sees those signs. One group may see one type of sign and symptom from one person, and another group may see that same person but see some different signs and symptoms.
Okay. Apostle Carmina, how are you doing this evening? Okay. But anyway, now let's go on. When you see those signs, and I was going to ask you that question when you said to be bold and
Mhm.
just ask them straight up, are you considering committing suicide? That's very even though for a lot of people that's very
Mhm.
difficult for them to
Mhm.
do.
Yeah, it is hard. And so there's a training that I do called Mental Health First Aid, and we actually practice that because it is hard. Whether it's the first time you've asked that person or it's the 10th time you've asked them, because it's always, what if they say yes? What do I do? Right. And so
Okay.
in when we look at suicide prevention, we really speak closely to, as hard as it is for you, ask it, because we want to be direct and we don't want to leave anything to chance. And so that then takes the guessing game out of it for us, and it takes the guessing game out of it from the person that may be experiencing the suicidal ideations. And so it's a yes no question that they can answer relatively easy. And so in this particular training that I'm talking about, we have folks practice so that you can feel how your body is going to respond to asking that question. Even though it's a practice role play, all the participants in the trainings that I've done over the years have said it was uncomfortable, because it's like, what do I do if they say yes? And so thinking about how your body may react to that, again, it's uncomfortable, but for me, it comes down to this: is my uncomfortableness be worth saving somebody's life? And for me, the answer is yes.
Right.
If it takes me being scared to death to ask somebody, and I've had to ask my child and my husband this question, and it hasn't gotten easier either time that I've asked it. But I'd rather do that and be uncomfortable for that moment than walk away from a situation where I could potentially never see that person again.
Now, what if you run into a situation where the person is hesitant to answer yes or no? What would be the next step as
Right.
far as your professional opinion would be.
Yeah. So what I would say is if you're not comfortable asking the question or if you find that the person is hesitant to reach out to those crisis numbers that you have scrolling across the bottom of the screen. Anybody can call the suicide prevention hotline. Anybody can use that crisis text line. And so what that does, it says, so if I'm engaging with you, I can say, okay, I'm either afraid to ask AZ this question or AZ is hesitant to be honest with me. And I'll say, I'm really worried about you because I've noticed this. And then I talk about the changes that I've noticed. And then I say, because I want to make sure you're safe, I'm going to call a trained mental health professional that can determine if you need immediate assistance at this time. And then call that crisis suicide prevention hotline, call that, use that crisis text line, and then have the mental health professional do the full assessment as to whether or not that person then needs to immediately go to a crisis treatment center or whatever the next steps may be. But that's the thing I think, having the courage to at least tell the person I'm concerned about you and then reach out to the trained professionals, right? That's what those resources are so great.
Right.
And I've had to call the suicide prevention lifeline with my husband. And I've said, this is my name, this is my husband, this is what's happened. And they asked me a couple of questions. And then they, in turn, said, okay, we want to talk to him. And then they asked him a couple of screening questions and then gave the phone back to me and said, okay, this is what we need to do next. So take the biggest lift out of your hands and reach out to those trained professionals on those hotlines, because then they can provide you with the guidance of what to do next.
Okay. All right. That sounds good because sometimes people don't know, if they say yes, they might, freeze.
Hmm.
I don't know how I would react if
Yeah.
someone said, "Yes, this is what I'm considering doing."
Right. Yeah.
Um so the directness, regardless of how uncomfortable it is
Yeah.
critical. Is that
It's absolutely critical. And then the other thing I'll add to AZ is there are times when folks, all they can think of, I can't think of the crisis text line. I can't find it in my phone. I can't find the prevention hotline. And the only number that people can think about is 911. And so
mhm.
what I tell folks is if you have to call 911, particularly in communities of color, make sure that you're giving the dispatcher as much information as possible, letting them know that you're dealing with an individual that's experiencing a mental health crisis, that they have expressed some suicidal ideations or concerns, so that they have as much information coming in to the situation. Because there are also police departments and sheriff's departments also have what's called crisis intervention trained officers, and those are officers that have gone through 40 hours of mental health related training. And so they come into mental health crisis situations in a totally different way than just a typical 911 distress call. And so, just if you have to call 911, give as much information as possible. And especially in communities of color, letting the person in distress know, I want to make sure you're safe. I'm calling 911, but I'm going to stay here with you. I'm going to make sure that they know that you're experiencing a mental health crisis, so that then that doesn't escalate some of the distress that they may be feeling.
Yes, and also in communities where maybe the officers are not trained,
Right.
in that it could end up in a very um,
Yeah.
unpleasant
Yeah.
ending for what
Right.
you were initially trying to do.
Right. Yeah.
Is that correct?
Yeah, you're exactly right. And that's why I think it's key that if you have to call, is that you give as much information as possible, because North Carolina, in particular, but a lot of the states in the U.S. have CIT officers. It's a national initiative that has been rolled out through most of the law enforcement agencies in the country. And so they may not have a huge number, but they at least have a couple that they can send out on those calls. And so that's why it's critical to give as much information as possible when they do have to call 911.
Yes, because I was so disheartened when I was doing research
Mm-hmm.
on the topic. I went to our county government um, website. It had a link for mental health or
Mhm.
whatever. And it had two paragraphs. And it did not have not even the National Suicide Prevention
Right.
Hotline number, lifeline number. It
Mhm.
did not have any information on how to do anything.
Right.
And I shared with you I was downtown today, and that
Mhm.
was part of the reason was to go let our elected officials know
Mhm.
that if someone is online and they're looking for
Yeah.
help, they can't get it from you. And so
Right.
everybody, I would encourage you to look at the websites of your city, your
Yes.
county, and to if you don't see any information up there, call
Yeah.
them up,
Yeah.
send
Yeah.
an email, do whatever you
Yeah.
need to do to get them. I mean, it's just a matter of updating the website. I mean,
Right.
it's not even 25 characters. You know what I'm saying?
Yeah.
100 characters.
Right.
They
Yeah.
could put that information up there.
Right. And
I
the
mean, it
neat
was
thing
just like,
too, with the prevention suicide prevention hotline in July, that's going to become a three-digit number, 988. So you don't have to
okay,
remember the one eight
great.
hundred, yeah, 273-8255 in July, and it depends upon geographic locations when in July it happens, but sometime in the month of July this year, that number is going to go to a three-digit number 988, which is helpful because not everybody can remember. I even struggle, and I've been using that number through for this training that I do for almost 10 years now, and I still can't remember, is it 1-800 or is it 188? And so having just a
Right.
three-digit number that folks can call is going to be helpful too. The one thing that I add about the suicide prevention lifeline that I think is key is that when you call, so if you're calling from a cell phone in particular, the you're routed to the um, suicide prevention hotline folks closest to the area code that you're calling from. So I used to have a 910 area codes for my cell phone because I
Mm,
had it for my back home where I grew up. And so if I were to call from that number, they would route me to resources closest to the Sampson County area. And so if you're so I know a lot of folks have varying cell phone numbers. So if you're calling, if you're living, for instance, in Goldsboro, and you have a 336 from Greensboro phone number, make sure that you let them know I am in Goldsboro or I'm in Wayne
okay.
County, so they connect you to resources that are local. Because otherwise, they're going to send you to the closest resources based upon your area code.
Okay. Okay. Now, let's get into the more into why this is happening within our community. Apostle Carmina, could you share with us, Miss Miss Herring? I'm calling her Miss Herring because she is such a professional, and I want
Please
to
call
make
me
sure that
Ruby.
I.
Please call me Ruby.
Okay. Well, Ruby, could you share with us exactly what is, why are we seeing such an increase within the community?
The main reason is people want the pain to end, and that's the only way that they know how to make it end. Um, there's a gentleman that tells his story when he attempted. He's one of few that survived a jump from the Golden Gate Bridge, and this
Mm,
really speaks to wanting the pain to end. um and he's not from the black community, but I think his story is so powerful. So anybody that's listening, if you just want to Google Kevin Hines, and there's lots of YouTube videos about his story, but essentially what he said, he was around 17 or 18 at the time, and he was hallucinating. He had bipolar disorder. He was hallucinating, and he had been up for like a period of 24 to almost 48 hours hallucinating, and the voices in his head were telling him to die. And so he tells the story. He gets on the bus, goes to the Golden Gate Bridge, and he's the last person to get off the bus. And he gets off, he goes up to the bridge, and he's leaning over the edge of the bridge, sobbing. And the voices are still saying, "I want you to die." A tourist comes up and asks him to would he take her picture? And he talks about her having an accent. And so he was like, "Yeah, I want to do something good before I died." He said, but he said, so he took, after he took a picture, he took a deep breath, climbed up on the rail, and jumped. And he said, as soon as his hands left and feet left that rail, the voices went away. They stopped.
mm.
They stopped. And so he was like at midair as I'm falling, he said, I immediately began to say, "Oh God, I don't want to die. God, oh God, I don't want to die." And so that story just highlights the main reason that I think a lot of people take their lives. They want the pain to end. And the pain can be any from any number of things, whether it's abuse, whether it's from mental health challenges like Kevin talked about, whether it's from some other thing, right? The pain is so great that they just want the pain to end. They don't feel like they can get better. And so they feel that their only out is to take their lives.
Mhm. Okay. Now, again, we have to be gentle with this subject,
Mm-hmm.
and I don't want to minimize anything. So, what what is the pain? You know, I'm a layperson. I don't understand what is the pain. Is it a mental pain? Is it a physical pain? Or is it different from person to person?
It varies from person to person, but it's often all of those. So for my daughter, her pain was she's a twin. They're fraternal twins, so she looks a lot different than her sister. Tamron is the twin that had suicidal ideations. So she's built like her mama. She's a big bone girl and has been all of her life. And her sister is very thin. So you got self-esteem and feeling different. I've got this twin, but I look so different from her. I look so much more mature than her, and she looks like a little baby still. And then you've got she loses a person that she has a very strong relationship with. Her and my mother were so very tight because we lived with my mom 14 months. They were from 2.5 to almost 4 years of age, and so she stayed with us the first 3 months that they were born, and then we lived with her from 2.5 till they were almost 4. So she had a really close relationship with my mom. And so when my mother passed, even though she knew that my mom had cancer, she still died, right? And left her. And so in her mind, the people that love you die and leave you. And as she
Mm,
was growing up and we started to see some of those behaviors, I remember I said to her at one time, again, thinking about how I was raised, I think it's important that folks understand that you and I talked about this. Words matter. The words that we say, not only
yes.
to our children, but to each other, they matter so much because I remember there was a time when Tamara was acting up, and I said, if you don't act right, I'm going to put you in a car and take you down to Wake County Human Services, and they're going to have to find you somewhere to live. It's kind of that scared straight stuff, right? That we know doesn't work. But I still thought, because I was raised by parents that grew up in the Great Depression, that I could scare it out of her. Many years later, my child was probably 18, actually. This is right after she graduated from high school. We were talking one day, and she brought that up. And she'd carried that for almost 10 years. And she said, I didn't think you and daddy wanted me. And
Mm,
so that's the pain, feeling neglected, feeling not wanted, feeling not loved. And sometimes it's physical pain. When we look at individuals that we've seen oh my goodness, where individuals kind of with the Dr. Kevorkian and individuals that the medical suicides, assisted suicides,
mm,
individuals that live in chronic pain, right? They think about the quality of their life and they don't want to go down that road where the quality of their life is going to be diminished. So they want that pain to end and they take their life. So it's a combination, varying from person to person, but typically it's because there's some type of physical pain, mental pain, emotional pain that they've experienced that makes them feel like they're not loved, no one cares about them, and nobody wants them.
okay. Apostle Carmina, are you in with us now? Can you hear us? I know she's texting, but Ruby, let's talk about the pandemic now. Did because we know,
Mhm,
hello, we know that there was a lot of, we were isolated,
mhm,
stay in the house.
mhm,
Um, a lot of things happened that we saw come up, whether it was increase of child abuse,
Right.
domestic violence, um, and suicide.
Hmm.
So how, in the Black community, especially because of the economic
Hmm.
disadvantages in some areas
Hmm.
within our community, do you feel that that played an increase in the um it is a factor in the increase of the number of suicides within the Black community?
Absolutely. Um, because we lost that interpersonal connection. So even though we knew that we were being socially distanced and socially isolating because the coronavirus could take our lives, we still, as human beings, need that human connection. And so what we found is that a lot of individuals out of that fear just totally withdrew completely and they didn't stay connected with their communities. And so with that social isolation, you start to feel, disconnected. You start to feel like, nobody cares about you because folks aren't reaching out. And so absolutely that absolutely played a part into it because excuse me, as human beings, it's a critical that we have that connection. And that's why I know one of the things that I was very intentional about, me and some of my girlfriends, we started having Sunday brunches over Zoom. And we were like, you don't have to dress
Mm.
up. Literally, there were days some of us rolled out of bed, pushed our hair aside, but we got together. We had our own food, whatever our beverage of choice was, whether it was tea, coffee. One girl had a mimosa a couple of Sundays, and we just connected because we did that before the pandemic, and we didn't want to lose that connection. And so I think we're seeing a lot of people that lost those connections with all of their groups, especially in that initial shutdown phase. It did impact us greatly in terms of increased mental health challenges and suicides.
Okay. So what do you feel is the how do we get back out of this?
Yeah.
Because some people, like people, there's a saying that you can get stuck in certain places, certain
Hmm.
areas in your life.
Hmm.
And, there could be people that might be still stuck in
Right.
that mindset of um, isolation
Right.
as far as the pandemic,
Hmm.
the relationship to be able to get back out into the world. What is your suggestions on that?
So I think a couple of things. Looking at some of their history. So, for instance, there are several risk factors that are associated with whether or not an individual is at increased risk for dying by suicide. But just looking at, what types of relationships do they have with other people and helping them reconnect with folks. I think that's key, building those connections, those relationships. And sometimes it's as simple as sending a text that says, "Hey girl, how you doing?" You don't even need to respond, but I was just thinking about you. Because oftentimes when we're not able to physically get together like we were initially, we think folks have forgotten about us, and that's often not the case. And so
Mm-hmm.
looking at reestablishing some of those relationships, I think is key. I think also thinking about, does this person have a medical condition or an existing mental health condition? So we know that individuals that have heart conditions, individuals that have diabetes, and it's rampant both of those are rampant in the Black community. Those two medical conditions alone put us at greater risk for developing depression. And so if we know that,
Mm.
continuing to reach out to someone. So if I had known at 2.5 when Tamron was diagnosed with an enlarged heart, if I had known then that that would put her at greater risk for depression, I might not have thought those signs and symptoms that I saw was her acting out. I might have looked at it differently and been like, this may be some anxiety or depression, right? And so just thinking about some of those health conditions that they may be experiencing that may put them at greater risk and just checking in with them. Um, and then the other thing I think that is key is just really around, making sure that they have somebody to talk to. And I think sometimes, those of us that like to help people feel like, oh, I want to put on my cape and I want to be AZ's go-to person. I want to be Apostle Carmina's go-to person. I want to save the day. And some days y'all just might not even want to talk to me. But there's somebody else that you can talk. You know what I'm saying? So there's somebody else.
Mhm.
So one of the things that I said to my girls and my husband, I don't care if you don't talk to me, but you find somebody that you can trust, that you can share what you're dealing with, right? Because they need to have that
Mm.
person to talk stuff through with.
Now you said something very interesting, and I want to go back to it. That there are pre-existing medical conditions that
Yes,
give
ma'am.
you a higher substance
Hmm.
likelihood of committing suicide. Could you
So it's
discuss
medical
that a little
conditions.
bit?
Yeah, it's medical conditions tied to mental health conditions. So it's not a direct correlation to death by suicide, but what we know is that there is research that shows one study that I saw several years ago that was kind of eye opening for me in particular was that men that have open heart surgery within 36 to 48 hours of that open heart surgery, the physician, the cardiologist, and nursing staff are noticing some signs and symptoms of depression. And so, if you know that you have, so we all can probably rattle off, we have a history of diabetes, different types of cancer, hypertension. But how many of us can rattle off mental health conditions that are in our family history? And so, depression and anxiety are two of the most common mental health disorders. And we see depression, especially, being a greater risk for individuals with heart conditions and with diabetes. And so those are just two. Individuals
Wow.
with chronic pain. So like I have rheumatoid arthritis. Thankfully, it's managed, so I don't have a lot of pain management, the pain issues that I deal with. But for individuals that do, we see that have chronic live with daily chronic pain. So think about fibromyalgia patients. They are at greater risk for developing depression, which is depression in and of itself is a risk factor for dying by suicide. And so it's connecting that physical health condition to a mental health condition. And that's why a lot of people, oh, I don't have a mental health problem. I'm not going to develop a mental health problem. You have a brain, you're at risk for developing a mental health problem, right? And so just thinking about how can you
Mhm.
maintain physical health, but also your mental health and well-being as well.
Okay. Now, prior to these types of surgeries or doctors, because I don't experience
Mhm.
any of these, medical conditions, do physicians discuss this with their patients?
Oh, that's a really good question. So physicians are better than they used to be. So it as research has gotten better around the connection and the correlation between physical health and mental health, doctors are starting to know more and have these conversations. We're seeing a lot of primary care practices that are actually integrating mental health professionals within their practice. And so many of your viewers and your listeners may have probably been to a physical therapy appointment where you sit down that first physical therapy session, they start asking you some questions. And one of those questions, I remember the last PT appointment I went to several years ago, one of those last questions was, have you thought about killing yourself? And I was like, yes, y'all asked the question, right? And it's because data is now out there where the medical field knows now there's correlation between those physical health conditions, and oftentimes people are more likely to go to their primary care physician before they'll be willing to go to a mental health professional because there's not as much stigma if I go to my primary care doc. You see what I'm saying with that? And also, access to your primary care physician is easier. It's a cheaper copay to go to my primary care doctor than it is to go to my therapist. So that's why we're starting to see a lot what we call integrated care, where the medical profession is starting to pay more close attention to physical health conditions and how they may impact a person's mental health.
Okay. Now, I want to pause here. I want to let all the Facebook users know that you have to, Facebook has enacted privacy, so we don't know who you are on live streams anymore. So if you want us to see your name, you have to give it permission in the chat when you respond, because we would, if there's anyone in the chat that needs any help or have any questions, now is the time to ask. Whether it's you or your loved ones, now is the time to ask these questions. This particular person, which we don't know who it is, so they were never told by their physician. They were never asked the question. Okay, we see who it is. Um, Thank you, Apostle Carmina. Um, that about regarding different medical conditions.
Right.
Excuse me.
Yeah. And so what else, the other thing that I'll say too is that a lot of the what I call old school docs, right, that have been practicing medicine for a long time, they were trained in a day and time where stigma around mental health was real and they didn't talk about it, right? That's not the way that they were trained. And so what we know is that a lot of the younger physicians that have been practicing within the last 20 to 25 years were trained totally different, where integrated care, talking about mental health as part of their medical training was a big piece of it. And so there are going to be gaps. I also think geographically, because I know, growing up in Sampson County, um, my guess is there are a lot of old school docs still there, and I'm not sure of how many of them might ask that question or might put two and two together to make the connection and say, hey, this is something that you may face. I know when Tamron was diagnosed with her slightly enlarged heart in 2005, the pediatrician never said anything
Mm,
about it being a correlation. And even her cardiologist didn't mention it to my recollection. But as we went along this journey with her mental health and mental illness, and I became educated and did my own research, I started to learn more about that connection. So one of the things that I'll say to folks that are watching and listening is be your own advocate, right?
yes.
And saying to your doctor, yes, they went through some world renowned training. Yes, they are the professional, but you know your body. Advocate for yourself and say to them, this is how I'm feeling, and be honest about it. Because sometimes when docs ask, how are you feeling? Oh, I'm feeling fine. But last night your head was hurting, your back was hurting. You've been feeling like, nobody cares about me. Tell them what you're feeling, because they can't help diagnose, right, or help find a treatment plan if you're not telling them what you're experiencing. And so that said, one of the common things that I think, I encourage folks to, if they have an opportunity to take this training that's called Mental Health First Aid, it's a really good training because it provides you with information about some of those signs and symptoms. It's not training you to be a counselor, but it's saying to me as a layperson, I know what these signs and symptoms look like, and I know that they vary, and I know how to have a conversation with somebody. Because what we know is that if you're paying attention to those signs and symptoms and you're reaching out and you're connecting people with the help, suicide is preventable.
Mm-hmm.
Suicide is preventable. Yes, there are situations where people die by what we call spontaneous deaths by suicide, where it's reactionary, but the majority of suicides are preventable. And some of the data that I've seen over the years from the this group that's called the American Foundation for Suicide Prevention, that they've released talks, and the American Federation for Suicidology, where they do a lot of research around suicide, is that individuals that die by suicide, in most cases, I think it's about 60 to 65% of them, have seen their healthcare professional within 60 days of dying.
What?
So think about that. With most folks that die by suicide, have seen their healthcare professional within 60 days of their death, before their death. And so there's an opportunity there, I think, for healthcare professionals to pay attention to those signs and symptoms. And we're seeing that change as somebody in the chat mentioned. But also as human beings, be your own advocate. Advocate for yourself. You know when something's not right with you. I was that person for my child. I had the pediatrician tell me for both of my girls, oh, they're fine, they'll grow out of it. And I looked and I was like, lady, something is wrong with these kids. And I don't know what it is because they were just all over the place acting out. I couldn't manage. And my husband and I were just really overwhelmed. And it took me breaking down in her office, like, I'm not leaving. And I said, I'm not leaving here until you find a plan. And I was in tears. And she, again, white lady with a big pediatric practice here in Wake County, she kind of, oh my goodness, what now? Took me outside in the hallway and kind of tried to talk me down. And I was like, no, I'm not leaving until you help me find out what's going on, what's going on with my kids. And that was the point that we started getting connected with folks that were starting to do assessments. The pediatrician's office started to do assessments for ADHD on Talia, and then we connected with a pediatric counselor for Tamron. And so advocate for yourself. Absolutely advocate for yourself and those that you love.
Yes. Now, I'd like to know, um, now that we know that there are certain medical conditions that could spark suicidal thoughts. Is it the medication or is it the actual? I mean, the medicate. Is it the medication for the medical condition that they have? Is that what sparks suicide?
No, it's
Suicide thoughts,
in
or
most
is it
cases,
the procedure? Go ahead.
no, it's not the medication in most cases. It's the chemical um, imbalance caused by the illness. So when folks have a heart condition, their biochemistry is off. When they have diabetes, hypertension, their biochemistry is off. So all of those chemicals in the brain get out of line and out of sync, and so it's that discrepancy in um, those brain chemicals that causes the increased risk for developing the mental health disorder that could then um, lead to suicide. The other
Hmm.
thing too about medical conditions I'll mention that I think it's important, folks, when I talked about earlier, the importance of knowing your family history around mental health conditions, because data also shows that individuals with schizophrenia and bipolar disorder, those are genetically passed on. So when we were having my daughter Tamron assessed for, she had been diagnosed with anxiety and depression at this point, but we thought that we might have had another diagnosis um, that we might have missed. And so her psychiatrist was doing some evaluations, and she asked family history, and I knew my side of the family. I knew that my mom's youngest brother had schizophrenia. So I shared that family history, but I did not know that my husband's side of the family, he had a great uncle, I think it was, that had bipolar disorder. Bipolar disorder is huge in terms of generational passing. So just like it's high likelihood that if my grandparents have hypertension, that I'm going to develop it, or
Right.
diabetes, right? The same thing goes for schizophrenia and bipolar disorder. And so I didn't know that. And so when the doctor asked, I was like, no, nobody has bipolar disorder. And we talked to his mom later, and she was like, oh yeah. And I was like, dude, you didn't tell me. And so that's why it's important that because in the Black community, we are huge on keeping secrets. We have all probably heard family stories about Uncle Junebug that Big Mama kept in the back room, right? Or we sent Auntie so and so up north or down south because they weren't quite, and I'm using air quotes, quite right in the head.
Right.
But it's important that we call it what it is, right? We call it what it is. It doesn't mean that they're not a good person. It just means that they have a brain sickness, and they
Right.
deserve to get treatment for that brain illness just like we would get them for their heart condition, their cancer. And so having these conversations within your families to know it, and it shouldn't, to the Facebook user that says what goes on in the house stays in the house, it shouldn't. And I'm not saying go out and blaring to everybody your business, but what I am saying is that if you know you have a family history of a mental health disorder, or somebody has died by suicide in your family, have a conversation with your healthcare professional about that, because it does put you at greater risk.
Yes. And I like what you said about brain sickness.
Mhm.
This, that we'll call, let's
Right.
if we have to rebrand something to make it acceptable within the Black community
Mhm.
so that stigma goes away, we
Yeah.
will definitely want to get some help.
Yeah, absolutely.
Now,
Yeah.
yeah, because I'm glad you stated that, as far as, because I remember back in the day when people said, just that something ain't right with Uncle Bob or
Mhm.
Aunt Sally or whatever. And but nobody would say
Right.
exactly what it was,
Mhm.
because but they did not have the information even that we have today. And
Right.
as you discussed, there is even the physicians are just getting to the point where
Mhm.
they're, when someone come in and they're going to have a certain medical procedure, that they even let the people know that there is a
Mhm.
predisposition, higher possibility that
Mhm.
they will be having these ideas.
Mhm.
My
Yeah.
Facebook, one of my Facebook users said, let's use correct terminology. Yes,
Right.
we will use correct terminology, but we're talking about the people that still have that stigma. If it means that it save a life, I can say brain sickness. You know what I'm saying?
Right.
Um, you
Yeah.
know, we want to use the correct thing, but some people just will not accept mental illness in their family.
Mhm.
They just will not.
Yeah.
And especially within the Black community, because there is such a stigma
Right.
in that.
Right.
So
Yeah.
we definitely want to, sometimes, we can get so technical, but we want to do whatever it takes
Mhm.
sometimes to get the
Yeah.
necessary help, because this type of sickness,
Mhm.
there's no coming back from this.
Right. Yeah. And so, you make a very good point. I think that, when we think about language, call it what it is. But like you said, recognizing that some people, it's still difficult for people to say mental illness. It's still difficult for people to say bipolar disorder. And part of that is because of the shame that we feel. Because oftentimes people feel like, oh, you can choose not to be depressed. And as a depressed
Right.
person, I will tell you, there were days after my mama died, I did not want to get out of that bed for nobody.
Oh, when my mother died, I'm
Yeah.
gonna tell you, I laid in the bed
Yeah.
for a month.
Mhm.
God is good. Um, I was I had a friend,
Mhm.
and he came over every day
Mhm.
to cook, clean, do whatever I needed done. And I thank God that I was self-employed.
Right.
Um, I just could not.
Mhm.
I could not.
Yeah.
I only thing I wanted to do was just, I
Mhm.
never thought about, going to the
Right.
next level, but I was in a very
Yeah.
um deep depression.
Mhm. Right. And so that said, I think, a depressed person, especially a person that's living with depression, their brain, it really comes down to the chemicals in their brain. Just like with folks that have diabetes, your pancreas isn't producing enough insulin. With mental health challenges, your brain is producing either too much or too little of certain chemicals. It's the same, it's just a different organ. And so that's why it's important that we talk about it and recognize that it is just as important as physical health. And knowing that a person that is depressed, if they could snap out of it, they absolutely would.
Oh yes, I would have definitely got up out
Right?
of bed.
Because
But
you know what,
but
right. Yeah.
what right. And I'm glad you made that point, that the brain is a part of the body and an organ just like
Mhm.
your liver.
Yes.
If you got liver disease or if your pancreas is about to burst, I mean, you're rushing to the hospital. You're rushing to get some help.
Right.
So we have to retrain
Yeah.
ourselves and rethink,
Yeah.
um, and educate ourselves to think to a different way about um, mental illness.
Yeah. Yeah. And here's the thing too is that um in we talk about mental illness, we talk about the stigma around mental illness, we talk about the stigma around suicide. We don't talk about the stigma around substance use, right? Uh,
Mm,
because substance use is a mental health condition. It is a brain disorder. It's a dependence on a substance in order to function. And so oftentimes I've heard people over the years growing up, especially, you can stop drinking if you want to. He can stop drinking. And just knowing that if it was that easy, don't you think people would stop? If it was that
yeah,
easy, think about people that are smokers. My mom was a smoker for all of my life. And even when she was down to her last days, she had lung cancer and she did really good and has stopped. And then when she was down to within the last 2 weeks of her life, she was like, I want a cigarette. And I was like, you know what? Give it to her because her life, her
right.
days are numbered. But she had done really well up until that point. But knowing that if people could not use the substance or not have depression or not have suicidal thoughts or not have episodes of mania, they would not. If they had a choice, I guarantee you they would not. And so knowing that this is something they truly cannot help, the brain controls the rest of our body. Just think
Mm-hmm.
about that. I want folks to think about that. If your brain is not working, the rest of your body is not working. So taking care of your brain is important because individuals that have there's one particular, this is going back to the physical health piece, and then I'll stop and turn it back over to you. But there's a piece of data out there that speaks to the fact that individuals with okay, so if I have diabetes and you have diabetes, AZ, and all you have is diabetes, but I have diabetes and let's say bipolar disorder, I'm at greater risk for dying sooner than you are. Not
Mm.
because I'm going to take my life necessarily because of the mental health challenge, but this is the reason. Because of my mental health challenge, I'm less likely to take care of my diabetes. I'm less likely to take
Oh,
my insulin, right? I'm less likely to eat right. I'm less likely to exercise because of my bipolar disorder, experiencing episodes of mania and depression. And so the data don't lie. The data does not lie. And so knowing that, that puts you at greater risk of just dying sooner because you have that co-occurring, what we call co-occurring mental health condition. It's important that we have these conversations and folks learn about what how their lives or the lives of there's those that they love may be impacted so that they can find a true treatment plan to manage both aspects of their health.
let me ask you a question. When you find someone that um is diagnosed with, let's like you said, diabetes,
Okay.
and they, don't do what, like you stated,
Mhm.
what they should do,
Mhm.
would you encourage people then to seek, help them seek some form of mental health assessment?
Right. So this is what I would do. So if I know of someone, and I talk about this in one of the trainings that I do, if you know somebody that has
And
diabetes.
we're going to talk about that training, everybody. Excuse me, Ruby. I'm going to give you the information at the end of the show because she has these wonderful classes that you need to have. But we want to make sure we get the information out first, and we're going to put her information, blast her information out, so you all can get her. But go ahead.
Yep. So if in my training I talk about if somebody has diabetes, for instance, we know that that puts them at greater risk for developing depression. If you notice these signs and symptoms, if you notice the change, you notice that they're withdrawing from people, you notice they're not hanging out with the same people that they hang out with most of the time, have a conversation with them and say something like, I noticed that, because we all have heard people say, I noticed I missed you at church Sunday. Where were you? Right.
Mm-hmm.
And so say the same thing. I noticed you haven't been hanging out. I noticed you haven't been coming to our weekly breakfast, or I noticed you haven't been doing this, or whatever the case may be, so that they know, number one, that you're paying attention. And then the next thing will be is, I'm really concerned. And how long have you been feeling like this? Right. So if they start talking about, I just haven't been feeling good. Because with depression, we saw with my daughter acting out. So throwing things, fighting. A lot of adults with depression, we withdraw. We don't want to talk to anybody, like you talked about, laying in bed. And so if we start asking them, how long have you felt this way? And if they start saying, a couple of days or a couple of weeks or a couple of months, ask them, have you talked to your doctor about that? So we don't even have to bring up mental health professional, because that may put a wall
Mm.
up. But just say, have you talked to your doctor about that? Right? Just like if we knew that their blood sugars were bouncing back and forth all over the place, we'd say, you better talk to that doctor about to get that sugar together in a line, right? So have you
Mm-hmm.
talked to your doctor about that? And if they say no, nah, I'm not interested. Sometimes what happens is when we make the suggestion, they're like, no, nothing wrong with me. I'm good. I just need to rest, or I just need to do this. We're like, okay, well, if you don't want help, then I'm going to go on about my business. And that's the last thing that we need to do. And so what I tell folks to do is let the person you've concerned about them, you notice this, and then just say, just think about talking to your doctor about this, right? And then a couple of weeks later, a month later, circle back. Hey, Z, the last time we were talking, you were talking about, not getting out of bed. Did you ever talk to your doctor about that? So circle back, because we have to meet the person where they are. Some folks are not ready to talk about it right there in that moment, because they may feel shame, right? They may feel shame. They may feel like, well, I shouldn't be feeling like this. I shouldn't be feeling like this. They may think something's wrong with me. And so don't further distance yourself from them because they don't want help. Circle back around to them and let them know, check in. Did you talk to your doctor about that? Um,
Mm.
because think about this, many of us have gone to the emergency room or urgent care. And let's say we go to the emergency room because our back is hurting, and they give us the muscle relaxer and the pain medicine. We're like, good, I got medicine. I can pop these pills and I can feel better, right? But then they
Mm-hmm.
also give us this document, and I'm just going to pull up a random piece of paper. They also give us this document that's this long list of, things you need to do, some exercises, how we need to sleep differently. And we put that paper off to the side because we got our muscle relaxers and our pain medicine, right? And so weeks and months go by where we are out of pain medicine, we're out of the muscle relaxer, or we decide we don't want to take those no more. And then we find this paper that says, oh, do these exercises. And we're like, oh, let me try those exercises now. Right. And so because we're willing to try them at that month or 2 months later, because we are at a different place, because the pain is gone, the crisis is gone. And so we want to do more preventative stuff where we do those exercises. And so think about it like that. Circle back around to the person and say, hey, did you have a conversation with your doctor about that? Because if it goes on, those signs and symptoms last for at least 4 weeks or more, then there's something going on that needs to be further assessed by their medical professional. And so, suggesting to them to talk to their doctor, but don't turn your back on them and say, well, you know what, you don't want help, then fine. If you want to be like this all your life, fine. And these are things that I've heard people say over the years to my friends and to some of my family members. And that puts up that wall where people feel like, okay, well, they really don't care about me then. Right. So if I am feeling really down, or if AZ is really feeling down, and that's what I've said to her, well, then go on. If you want to hurt, then just hurt. When she's ready to have this conversation with me, because now she has the words to put in to the words to describe what she's feeling, she's not going to come back to Ruby, because Ruby was all judgmental, right?
Mm.
And
Right,
so, but
right.
she may come to Carmina, because Carmina left that door open and said, well, I'm just worried about you. I'm going to check back in. And so keeping that door open, because as Black folks, and it's we have to break the cycle of, well, that's how I was raised and I turned out all right.
Mm-hmm.
My question is, did you really? Right?
Did you?
Did you really? You're surviving, you're not thriving though, in many cases. And so changing that language and how we talk to people and how we talk about mental health challenges and substance use disorders is key, because until we start to change how we have those conversations, and still we stop being judgmental. My mama said something to me growing up that I will always remember when we talk about um, those of us that are Christians and how judgmental we can sometimes be. My mama used to say, "You don't have a heaven or hell to put me in. Only God can do that." And so, why are we then, as Black folk, particularly Black Christians, judging somebody for their behaviors that's caused by an illness? Who are
Right.
we to judge? Leave that.
Right.
We have to be more God-like and leave that
And
door open.
yes, exactly. And I want to inject here because we're a Christian network and everything. Don't end with, if you say, ask someone how they doing, and Apostle Carmina always laugh at me about this. She always asks me, how you doing? And my favorite thing is blessed and out of favor. Blessed and out of
Mhm,
favor.
mhm,
You know,
mhm.
let's get real with
Yeah,
people.
yeah,
If you're going through issues, if you're struggling or someone that's
yeah.
struggling, let's be truthful. Find someone you can trust. And if you don't have someone you can trust, the number is below. You
Yes.
can call, you can text. That's why it's been streaming throughout the
Mhm.
stream, because I want anybody that watch at any point to not have the opportunity to call.
Right.
Now I want to, this is so good. It's like I want to keep you here, but I know, look, I'll be talking all night. But I want to ask one series of questions, and then we'll get into the other part. Where does medication for mental illness, whether it be depression, bipolar, schizophrenic, how does that come into play? And discuss that just a tad bit. And everybody, we're just going to have to come back. Matter of fact, you're going to have to just contact her directly. Uh, but go
Yeah,
ahead,
that's
Ruby.
a really good question. Here's what I say about medication as it relates to mental health conditions. Everybody has their own belief about medicines, whether they work or not. We all look at those inserts that say, do not, you have all these side effects, right? But here's the thing about medicines as it relates to mental health challenges. An individual, in most cases, will not need medication for a long term to manage
Mm,
their mental health condition. So think about it. There are folks that are diagnosed with diabetes that only need to take that pill for a certain amount of time until they get their numbers down, and then they learn how to manage it through eating and exercise, right?
mm-hmm,
Same thing goes for mental health conditions. Oftentimes we may need the medication to get us stabilized until we're able to develop the tools and the coping mechanisms to manage those symptoms that we're dealing with, right? And then we may not need it ever again. There are some of us, and I say some of us because I have been on an antidepressant since 2005, and I have tried to stop taking it, and I can't. And so I have come to realization I'm going to be on that for the rest of my life. But you know what? I'm
and
okay.
there's no shame. I mean,
No
just
shame.
like you said, if you if you have diabetes, or if you have high
Mhm.
blood pressure, and the doctor said you're going to be on this for the rest of your life, you have no problem with taking it for the rest of your life.
Right, right,
Go ahead.
exactly. And so what I have embraced that helps Ruby be true to who Ruby is. Because on days that I don't take it, I cannot function. And so what I say to folks is, I don't want to take another medication. I don't want to do this. You may only need it for a short amount of time, just like therapy. Most folks with mental health conditions don't need therapy for the long term. They just need it long enough to stabilize and develop positive coping mechanisms to manage
Mm-hmm.
those signs and symptoms. And so I am a believer of everybody needs a therapist, if nothing else, to help you talk about life, right? You may not have a mental health condition. You just may need somebody to talk about your cousin and them, your sister and them, the husband and them children, right? Have that third party person to help you process it, because what happens, I want to speak to my black women especially. We
Go
have been
ahead.
programmed, and I'm saying we because I was programmed. We have been programmed to be that strong black woman.
We need to deprogram ourselves, Suge.
Do you hear me? Because it's killing us. And I'm
Right.
going to,
You don't
you know,
hear any other racial group talking about being no strong woman. We are
right,
feminine. Walk in your femininity. That's what I tell my women. Come on now.
right.
All
And
right. But go
and,
ahead.
and we're carrying other people's stuff, right? And we have
Woo.
generationally, from slavery to modern day, we've carried other people's stuff, and and it's killing us. And so again, I'm going back to personal examples because folks, when y'all saw me log on at the beginning, y'all probably didn't know my story, that I have had depression, that I've been suicidal, that I have a child that has been suicidal and was hospitalized for 10 days. My husband was suicidal. My other daughter has ADHD and anxiety. My family lives with mental illness, but we are thriving because we have used medication, we have used therapy, we have used prayer, all three together, to find those things that work. My daughter, that was hospitalized for 10 days, was on medication from the time she was 8 until she was about 17. She's 19 now and she's medication free. The only medication she takes, she's off of her heart medication. She's off all of her mental health meds. She takes a sleeping pill at night. She's able to manage her anxiety and her depression through therapy, through writing, and drawing. So
Hmm.
she's developed those positive coping mechanisms. We don't have to be strong black women, because there was a point in time where I said I was scared to travel away because I was fearful of, excuse me, the hell that was going to break loose at my house with my child and my husband because of her, when we were in the thick of her mental health condition. And I was in parent therapy because the program that she was in at that time required us to be in parent therapy. And I had a psychiatrist that said to me, travel. And I was like, well, what if, and I'm this far away and I can't. And she said, here's the thing, whether you're home or gone, it's gonna happen.
Hmm.
She's got she's got her therapist, your husband has got me. And the moment that, I mean, literally, I would have pains in my chest. My chest would feel like I had a weight on it. But the moment that I start, and I would always try to anticipate, well, what can I do to prevent Cameron from acting out? What can I do to prevent Tamron from throwing stuff? And I was always on edge. And she said, you're going to end up dying. And I was like, well, what do you mean? I'm trying to support my child. And she's like, Ruby, no, you can't do this way. You can support her, but you don't have to always anticipate. And so I was trying to be that strong black woman. That's the way my mama raised me. And the moment that I stepped back and allow my kids to learn how to manage their own stuff, and I was their advisor. If you need a question or you need some money, come see me. But I stopped trying to figure it out, because
Right.
the stress of trying to figure their stuff out on top of my marriage and my work and trying to build a small business, I was about to die. I'm telling you, I was about to leave this world. And so when I stepped back, it felt like the weight of the world had been lifted off my shoulders. So I say to black women, don't buy into that strong black woman thing. We don't have to be
Mm-mm.
strong. We are human. We are
Exactly.
human. We have emotions and we need to express our emotions. Now, what I'll say to our black men can express their emotions. It's okay for black men to feel sad, hurt, angry,
Hmm.
and to say that. It's okay for black men to cry. You don't have to man up.
Right. And you don't have to pull yourself up by the
You
bootstraps
don't.
because you that's impossible.
You don't.
But
Right.
I want to you made a point and I want to get to it. I don't want to belabor. You stated that you were you doing your small business. So tell us about who you service because everybody you see Ruby knows what she's talking about.
Yeah.
She's Ruby knows what she's talking about, baby.
So
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 tell us about your business and how
yeah,
to contact you
right.
and everything.
Yeah. So here's the thing. I'm not a mental health clinician, but I have been a mental health educator for oh my goodness, since 2009. No, 2000, yeah, 2009. Yeah. I've been a mental health educator since 2009. So I've done a lot of trainings, planned a lot of trainings for mental health professionals, and as a result, I've learned a lot of information. I've been a mental health first aid instructor since 2014, and that training has taught me a lot. So I know just enough about clinical stuff to be dangerous. So I don't diagnose, but it does help me have an understanding to have conversations like we're having here. Um, but because of my family's lived experience, I've done my own research, right?
Right.
Because even though I was a parent that was talking to a Duke trained psychiatrist, and she said your child has depression, and I was like, no, she don't. That girl's got bipolar disorder because she's doing this, this, and this. Didn't know any better. In children, depression looks like bipolar disorder. So I say that to say, I've learned a lot just through personal experiences, but just my professional background. I've done some work with my last full time job was with the state of North Carolina, managing mental health and substance use training programming for youth in our juvenile justice system. So I've had the opportunity to be at tables that I typically wouldn't have been. But I want to take care of people. I'm a social worker. I have an undergrad in social work, so I've been a helping person all my life. But with my business, what I do a variety of things, but the bulk of it is working primarily with businesses, government entities, and that ranges from libraries to any other type of government agency to nonprofits to develop strategies that help them address mental health in the workplace because we have so many people leaving the workplace because of their mental health. But I also, the other part of my work is working with community groups and nonprofits to do a training that's called Mental Health First Aid. And Mental Health First Aid is a training that's for the general public that trains them to recognize signs and symptoms of a mental health condition, signs and symptoms of a developing mental health crisis or substance use crisis, and how to connect that person to the appropriate professional help. Right? It's not training folks to diagnose, but see something is wrong, say something, and then to do something is connecting them to that professional.
And what is the number for them to contact to get that training?
Right. Yeah, if they're interested in the training, they can reach out to me. My Google Voice line is 919-578-5780. So that's
Okay.
919-578-5780. Or you can also email me, and I'll give my email address, and you can also post this on the Facebook page too. It's RUBY, so Ruby, just like the gemstone, at
Wait
RB.
1 second.
Okay.
Give me 1 minute.
Okay.
Okay, I want to um add some information here.
Okay.
Okay. Excuse me. But I want to make this phone number available. And again, it is because I
919.
don't I really don't want to I don't want to take the hotline number off.
Right. Yeah. No, no,
we
leave
need to,
that up.
we need to got to keep the hotline number on.
Leave that up. So yeah,
Yes.
it
And so
is
now give your email address
sure.
again.
It's Ruby, RUBY.
I put the phone number in the chat, everybody. Okay,
Okay.
Ruby.
At RBH So RBH are my initials, Ruby Brown Herring. So RBH Wellness, WELLNESS.com. So it's Ruby, RUBY, at rbhwellness.com. Yep, I see it in the chat. That's it.
Okay, good. I'm putting it in the chat. I want to make sure everybody sees it. Um, Ruby at
Mm-hmm.
rbhwellness.com.
.com.
Yes, we want to make sure um, that everyone gets this. This is what are the dates of the class, and even if you want to reach out her to her for other reasons, this
Right.
is um,
Yeah,
Ruby's
I'm going
information.
to be scheduling actually Apostle Carmina, her faith community is going to be doing an adult mental health first aid class in March. So there may be some opportunity for space in that. But all I need to schedule a class, if you have at least 5 people, I can schedule a class for the community um, that way. So reach out to me with your interest, and then if I have enough interest, I'll pull together a class. And I can do it right now. I'm only training virtually because
Well,
of
that's
the
great
COVID.
because we have people that watch all around the world. So
Yeah.
if you need this training, I don't care. We don't care where you're at. You got a phone call. If you have an email, email her.
Right.
Go ahead.
Yeah. Yeah. And so I can train virtually anybody in the United States. So reach out to me at that email address that's in the chat, and I'll be glad to talk to you about doing a training. But it's really the training is it's a total of 8 hours, but it's not all at once. You do two
Right.
hours on your own on the computer, and then the rest of it, the other 6 hours, is led by me over Zoom. So it really gives folks the tools to help them develop that confidence to support people that are living with mental health challenges. So I love it. It has saved lives. I hear folks that attend trainings all of the time that reach back out to me and say, I use mental health first aid. I did a training for a group out of Chicago in November, and we broke it into 2 weeks back to back. So the first one, after that first session, I had a participant come back that next week and said, I used this with a student last week.
Mm-hmm.
And so it's helpful. It provides that confidence to ask some of the questions that we've talked about here tonight. So yeah, definitely reach out, and we can have conversations about that training.
Great. Well, everybody, I mean, this has been so fantastic, and I want to thank everybody for tuning in and joining in the conversation,
Mhm.
and for the replay crew. We love you. Replay crew, we know you out here. Again, if please like, share, and subscribe. Definitely share this video with everybody you know, because you never know. You hitting the share button
Mhm.
on this video
Mhm.
could save someone's life.
Absolutely.
It might be one life, it might be thousands of lives. So please share, share, share this video with others, because we never know what someone is going through. A lot of people looked at Miss USA
Mhm.
2019. They were like, I mean, in utter shock,
Yeah.
because how could you imagine such a beautiful woman with so much? She's a talk show host. She's beautiful. She's gorgeous. I mean,
Yeah.
you know, so
Living in
you
so much
never know
pain.
what
Yeah.
someone is going through,
Right.
and it's important for us to get this information out in our community. And this training that Ruby has, she knows what she's talking about. And bring, if you work on a job,
Mhm.
bring this to your employer and say, hey, we might need this training.
Yeah.
Call Ruby. That's her number, that's her email address. Reach out to her. I cannot express enough how much how important this
Yeah.
is,
It
because
is.
I'm gonna tell you, one of the things that you told me that you shared tonight that I thought was wrong and I would never do. That's why it's important to share this information.
Hmm.
Is when you said confront head on, ask
Hmm.
the direct question.
Hmm.
I would have I would have never
Right.
guessed it
Yeah.
because I would be thinking, oh my gosh, that's going to tip them off the off the
Hmm.
edge if they're in the
Hmm.
problem. But see, I
Yeah.
was wrong.
Yeah.
And so anyway, is there anything that I failed to ask you that you feel that's important or you wanted to share before we end it?
Two things quickly. I think, the fact that you just said, I learned something tonight that changed my viewpoint, right? And I
Yes.
think
I
just
learned a lot of things.
just acknowledging that, because oftentimes we're like, yeah, yeah, I'm not gonna change, I'm not gonna do that. But just really think about the information that we've shared tonight. And it's not saying you're gonna always get it right. I still mess
Right.
up. I
Good.
still mess up because we're human. But as you that saying, you know better, you can do better, right? And so just try to
Right.
learn as much as you can. And then the second thing I'll say, for those crisis numbers that are listed, the hotline and the text line, a person doesn't have to be actively suicidal to use those either. If you
Right.
know somebody that's in distress and they like, I just need some, I don't know what's going on, I need somebody to talk, they can reach out to those hotlines as well. You don't have to be actively suicidal in crisis to use those numbers.
Yes. And I learned that also. Um, and just in all, there was just so much I learned. It's also the part about certain medical conditions, making it you're more susceptible to this. I'm just I, I'm gonna have you back, Ruby. I'm
Glad
telling you,
to. Glad to.
I'm going to have you back because you have shared information that is critical to our community that we need to definitely um, share information, rethink, reprogram ourselves and how we think and what we do. Um, I just I just want to I just anyway.
I thank you for having this
Again,
conversation.
like I
Let me
said,
say
this
that
is
to
the
you. I thank you for having this conversation, because Black folk go to the church when they don't turn to anyone else. And so
right.
you taking that step to have this conversation on your platforms is key to helping change how this impacts our people. And so I thank you for just for that opportunity and that foresight of feeling the need and feeling led to have this difficult conversation.
Yes, I tell you, I thank you, but it was truly God because I was just sitting there and just seeing person after person after person. And sometimes we can get numb to certain
Mhm,
things because it's not brought to the light if
mhm.
you're not in that circle where you know it's going.
Right.
But, God has a wonderful way of bringing things to your attention,
Mhm.
especially when people, there was the mayor of Hyattsville, Maryland. I used to
Yep.
live in Hyattsville,
Yep.
Miss USA, and
Yep.
Regina's son, and
Fun. Right.
I mean, it was just like boom, 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 boom,
Yeah.
boom. I was like,
Yeah.
whoa, 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 whoa. The
Yep.
Lord was like, wake up, Az. You got to
Right.
bring this out. My people are dying, and
Yeah.
I thank you so much for taking the time out of your day.
Sure.
And again, did I cut you off on anything, or
Mm-mm.
you?
No, I
Well,
have talked
everybody.
to my heart's content.
Well, look, I could continue to talk because it was just so much stuff. But I know everybody, we thank you so much for
Thank
inviting
you.
us into your homes. We love you. Please, again, like, share, subscribe, share this video, even if you don't like, even if you don't subscribe, share this
Yeah.
video with everybody you know. And
Yeah.
again, everybody, we thank you so much for inviting us into your homes. You have a very blessed and prosperous night. Goodbye.
Bye, everybody. Thank you again.
Thank you. Oh my gosh. I just